The goal of this video is to show you how to use Teamio's Practice Pulse on a daily basis. This will be for everyone in the administrative team at the front, the assistants, doctors, hygienists, basically everyone in the office. For the sake of this video, I'm going to assume the settings which you see here, the Practice Pulse settings are already taken care of. Okay, so you don't have to touch this area at all, right? So we're going to dive right in, and I am going to be switching back and forth between this screen here and the Open Dental screen. All right, so let's dive right in. So when you first start Practice Pulse, which is the first icon on the left side navigation menu, okay? So that's how you get to Practice Pulse. So when you first load it on your screen, it's going to be empty. You see nothing in the check-in area. You see nothing in the operatories. You don't see anyone in the checkout because you haven't marked anyone arrived. So this is what it will look like when you start your day in the morning. So now let's switch to Open Dental. So, I've made a couple of fake appointments here. All right, let's assume these are the appointments that are coming up right now. And the first thing that's going to happen is when the patient walks in through the door, it's going to be the job of the front desk. You may already do this in your office, but the job is to click on the appointment and mark the patient arrived. So if you go on the right side of Open Dental here, on this side here, there's a little thing called arrived. It may be called something else in your practice. Whatever the setting is, whatever the text is that indicates the patient has come to the practice or has arrived. Okay, so you click that. So now the color indicator also changes. I'm assuming you guys have that set up in Open Dental. So now as soon as you mark the patient arrived, immediately it will also show up. The patient is going to show up in the check-in area, right? One thing to notice is you see the patient is marked arrived. It says 1, so 1 patient is arrived. That's the total count. And 0 patients are marked as ready. That's the same exact green dot you see here. This is the same appointment block that everyone in the office will see at the same time. So this is all real time as it's happening in the practice. So if you have Practice Pulse loaded up on 10 different computers throughout the office, everyone is going to be looking at the same information. So everyone knows where a patient is, okay? So now she may have arrived at the office, but maybe she needs to update her medical history. So she's gonna go do that. So she's not ready to go back yet. She may be filling out paperwork, et cetera, et cetera. Okay, so now this patient is also here. So I'm gonna mark this patient arrived. Okay, I'm just gonna mark this patient arrived as well. All right, maybe another one. Okay, so far we have 4 patients that are arrived. And then if you go back to Practice Pulse, what I would advise is Practice Pulse should always be open on a second monitor. If you have dual monitors at the front, that's even better. Front desk, you have Open Dental open on one monitor and Practice Pulse on another, so you guys can see all the information all at once. So you can see 4 patients are arrived so far. We know that Pamela is not ready. She's filling out paperwork. But we know that these 3 patients are ready to go back. So I'm going to go, and now the front desk, this is the, we talk about patient handoff. This is the job of the front desk, is to mark the patient arrived and let the back know when they're ready to be brought back. So you click the patient that's ready to go back for treatment and you click ready. Now, again, same thing. My text says ready. It may be called something else in your office. It may be called ready for treatment or whatever it may be. So you select that option to mark the patient ready for treatment. All of a sudden you see that it's now orange, okay? I'm also gonna click this patient, also ready, okay? So now, going back to Practice Pulse, everyone in the office who's looking at Practice Pulse, they can see that we have 4 patients in the check-in area, 2 are arrived, they're all arrived, but 2 are actually ready to go back. That's the orange dot, the same exact color you see in Open Dental, and you can see the total count up there as well, okay? And now, let's say this patient is Dylan, okay? This patient is ready to go back. Now, the clinical assistant is also looking at the screen in the back, so the clinical assistant realizes that, hey, Dylan is ready to be brought back to the operatory. You can either, now it's going to be the job of the clinical assistant to move the patient from the check-in area to whichever operatory they're going to be in, okay? To move the patient to the operatory, you can do it 2 different ways. You can either drag and drop them to the operatory, okay, like I just did here, or this patient, you can click the blue icon here that you see, and it'll bring up any op that you would like to put this patient in, okay? So I'm gonna put this patient, let's just say for now, in hygiene op 1. All right, so now the patient is there. One thing I do want to go back to, as a patient is marked checked in or arrived, the front desk should immediately be alerted to all the icons that you see at the bottom. So, for example, Pamela is marked arrived. She's still at the front desk. She's not ready to go back. But you see this red icon. You see gray and then you see red. If our icon is red, that means it's an alert. So this patient, the dollar sign is red because there is a pending balance on the account. So you can actually click on it and view the balance. This is the balance of the guarantor of that patient on their open dental account. This icon here, the red icon next to the dollar sign, this is for a recall. Okay, so if you click on it, it means either this patient or at least one of their family members is due for a recall. And this is important because while the patient is there, you can either do this at check-in or do it at checkout. You're going to see the same information. But let's say while the mom is there, it's good to know that two of her kids and the husband is due for a recall. Okay, so while the mom is there, you may want to ask her and say, hey, why don't we go ahead and schedule their appointments as well? The other gray icon, the third gray icon that you see there is for any pending tasks. Task meaning if this patient, Pam, has any active task that she's tagged in on Teamio, that icon will be red. Okay, and I'm going to show you an example in just a few. So now these patients are being worked on. They're in the operatory. So now what I want to focus on, look at the functionality of what you can do while the patient is in the operatory. So now let's get to the point of talking about calling any team member in the office as an alert. Okay, so let's assume this is the hygienist seeing this patient in Hygiene Op 1. She's seeing this patient, Savin. So now she needs to call the doctor for a hygiene exam. So what she can do is just click this little person icon. That's how you call out somebody. So you would click it and this little send alert pop-up comes up. Okay, you have two options here. Either the hygienist can click this quick button. She does not have to press anything else. Let's say she's calling out Dr. Shah for a hygiene exam. All she has to do is click that button. So let's go ahead and do that. She's calling out Dr. Shah for hygiene exam. That's why it says Neelay Shah. That alert is going, this text Dr. Shah for hygiene exam is for this user above. This alert is for this user above. Okay, these two alerts is for the user Suhali. Okay, so for example, this hygienist calling out Dr. Shah for an exam, she's just going to click that button. And you see a few things. You see the Windows notification pop up on the bottom right corner. You also see this blue alert pop up, and you may have heard a sound come up. Okay, so for each individual office member in the practice, whoever it may be, whether it's a front desk personnel, clinical assistant, any provider, hygienist or doctor or associate, they can individually have their own colors and sound system set up in settings. So let me just go back to that area. In the settings, like for example, these are the team members in my practice. And for each team member, for example, myself, I have blue color, which is automatically selected from Open Dental because the provider color is blue for me. Okay, so that already gets picked up. For Dr. K, it's going to be this green. For my sound is this alert. So that's the sound. I don't know if you're hearing this via this audio recording, but that's each team member, you can set up a different sound, okay? And basically from the get-go, if you set it up correctly, whenever you send an alert for a user, without looking at the screen, they'll know, oh, that's my sound. I'm being called for. So now they're going to look back at Practice Pulse screen and say, oh yeah, I'm being alerted. So I got the alert on my screen here. My hygienist needs me. I see the blue color right away. I know that's me. And I'm being called to Hygiene Op 1, okay? And it says elapsed time. This way I know if I'm working on a patient in my operatory, I will know that a hygienist, it's been about a minute since this alert has been there. Okay, so it basically tells me how long the hygienist has been waiting for it. So now let's go back and create another alert. Okay, let's say Dr. K is in RK Op 4. She's going to create an alert for an assistance. Let's say she needs Sohali, this person here, for assistance for cementing. Okay, she can either click this button, which is an easy button created through settings. And like I said, we can do that during onboarding. Or you can just manually select which user you would like to call. Let's say the same assistant, I'm going to select, Dr. K is going to select Suhali, and she's going to write a message. Need help with probing, whatever it may be, and x-rays. Okay, so I'm going to say send. Now that's the color chosen alert for this clinical assistant named Sohali, and she's also going to receive this Windows notification. Okay, everyone will see the Windows notification. Everyone will see the same exact screen you're looking at. This way, everyone knows who's being alerted, how long they've been waiting. Now, I can see the hygienist, Dr. Shaya, must be busy with his patient because he has, the hygienist has called out to him and this alert has been there for 2 minutes. Now, let's say I'm ready, me, Dr. Shah, I am ready to do the hygienist exam. As soon as I step into the room, I'm going to go ahead and click the alert off. Okay. So that alert disappears from everyone's screen. So everyone knows that nobody's waiting for Dr. Shah. Okay. All right. So it's pretty simple, self-explanatory. Anytime you need to call somebody out in your office or you want to call upon somebody, I should say, you just click the person icon and either select a user, type a custom message, whatever it may be, or if you have created easy buttons for your practice, something quick, like you need somebody for cementation. That's why we created these. You just click that and it will send an alert with the right message. So now we are ready to check this patient out. Let's say this hygienist has finished with this patient. Dr. Shah has done the exam. So now this patient is ready to go to checkout. So one way to do this is the hygienist goes ahead and brings the patient to the front desk. Okay, either the hygienist can click on this checkout icon. Okay, when you click the icon of checkout, this panel pops up. So let's go over that. This is the checkout panel for when you're checking out a patient. It's going to show you a couple of things. For example, appointment procedure, what the procedures were attached to the appointment. It's also going to show you the out-of-pocket obligation. In this case, because the insurance covers it fully, there is no out-of-pocket obligation there. And as I had mentioned before, the mom, who is the guarantor, has an account balance of $51. That's why this pending account balance shows up here. So this is super important. It's like an alert as you're checking out a patient, okay? Let's close this out. I'm not gonna save. I'm gonna come back to this screen. Let's close this out for a second, okay? So if you close it without saving, the patient is not checked out. It's gonna stay there. Okay, so now you can either click that button to check out, or you can also drag the patient to the checkout area. So those are two different ways to check out. Now let's go ahead and actually check this patient out. Okay, like I said, either the hygienist can do it or the front desk can actually drag the patient to the checkout area. You have to decide how you want it done in your practice. Okay, but the important thing is, so let's go ahead and look at what you're looking at on the checkout panel. I already discussed what you're seeing on the top. Couple of things on the bottom. So let's say the hygienist marks, okay, this patient needs to come back for a 3-month recall. So if all she has to do, instead of typing, she can just click this checkbox and look what happens automatically. This auto note shows up here. These are quick notes that are set up in the Practice Pulse settings during onboarding. Okay, you guys can change those things anytime you wish. Okay, so you don't have to type anything. These are kind of like auto notes in Open Dental. If you were to click, let's say, if you unclick it, it also disappears. Okay, so let's say this patient needs to come back for recall 4. There's no need to tell the front desk this patient needs to come back. You can just click that and set those notes up accordingly. Okay, if this patient was for Invisalign, for example, let's say I'm going to unclick that. Let's say this patient came for, let me see what I created a quick note for. I believe it was this one, remove attachment. Okay. That's what you did. We'll be removing buttons if the patient is satisfied, polish, and clean. That's what the next visit is going to be for. So again, you guys can create and customize these quick notes as much as you want. You can add those to the settings. Okay, and it's completely customizable. As you're checking out a patient, the front desk should also be alerted to, again, the same thing. Are there pending recalls? So you're going to see either whether or not this patient is scheduled for a recall, and also if there's any family members due for a recall. You're also going to be able to see if there's any planned appointments. Let's say this patient here is for hygiene. If you are using Open Dental planned appointments and you have any planned appointments created for any procedures, they will show up here. Okay, all right. So let's say I have this note here and I'm going to go ahead and save this note. The note that you saw there will automatically be inserted into the Open Dental patient's communication log as a Teamio checkout entry. Okay, so those notes are saved. All right, so this patient is now checked out. And you can see the counter getting updated here. Checked out patient 1, dismissed as 0. Now, this patient is still at the checkout area. Okay, so everyone looking at the screen in the office can say, oh yeah, there's one patient at checkout. Okay, all right. As soon as the patient walks out the door, what you can do is click on this dismiss icon. So once you click it, It's doing something in the background. You don't need to worry about it. It'll do its thing, but you can step away from it. Okay. And once you dismiss the patient, which means patient is gone out the door, it'll turn to this kind of like opaque. Okay, so you don't have to pay attention to it. You can still bring up your notes, like your checkout notes. If you need to go back at the end of the day and just kind of look at your notes, you can go back there. So both patients that were in the check-in area are now ready to go back. Notice what happened. I just dismissed this patient. Let's go back. This patient, Savin, who I just dismissed, opened Teamio will automatically update their status in Open Dental as well. That's why you see the blue color there, okay? Blue color means is dismissed, okay? And that's why you see it updated there. Okay, so I'm going to bring, I'm going to leave one patient there, but I'm going to bring, let's say, her to op 1. All right. Now, again, you can see that patient is, they have pending recalls. They have a balance on the account. Okay, so everyone can see this information. All right. And now, let's say you can create an alert, assistance needed for cementing or whatever it may be. Okay, same alert shows up here. I'm going to close this one out. Again, there's the Windows notification that popped up. All right. When you move the patient from check-in to one of the operatories, Teamio will also automatically update their status to in-room. Okay. So for example, let's take a look. Now you see it right there. The status has been updated to that little green dot. Okay. Right there. So if you click on another patient and kind of click on it again, it'll show you that in-room status is marked in Open Dental. Okay, you can double click on it and you can look at it in here as well. Okay, you can actually see confirm status in treatment room. So that's how you verify the treatment status. The status of the appointment has changed. Let's go back. So hopefully you're with me so far. I'm going to go ahead and check this patient out as well. All right, you can see the pending balance. I'm going to say the next visit is in 3 months. What I want to do is, this patient is at checkout and I have something to, I have a task that I want to create on Teamio for this patient. So I'm just going to, you don't have to tag this patient. It'll automatically tag this patient because you're creating the task for her. This is a test task. Okay. Now you're going to say add task and you can see this task is already added for Pam. And it's due today as default. As you guys are already aware, when you create tasks in Teamio, they're all marked as default tasks to be due today. And you can change those, change that due date to be, let's say, the 9th. Okay, I'm going to go ahead and close it. All right, so now that it's saved, I'm also going to save my checkout notes. So the patient is now checked out. I'm going to go ahead and mark it dismissed. You can see right there in ComLog, Teamio has inserted automatically a note, Teamio appointment checkout notes and the notes that you wrote down. Okay, all right, so that's what I wanted to show you guys. I'm going to mark another patient arrived. If this patient is ready, it has not been 5 minutes. In settings, there's an alert that would pop up if it's been more than 5 minutes. Basically, what that means is there's timers. If a patient is marked ready and they're not moved to the operatory, which means the patient is waiting too long in the front desk area, you're going to see a little pop-up that says waiting for X number of minutes. Okay, and then everyone in the office can see that screen. So everyone knows, hey, there are patients waiting in the check-in area who are already ready for treatment and they're waiting. Okay, so you will see that here. It just hasn't been 5 minutes and that's why the alert is not coming up. I'm going to go ahead and move this patient into checkout as well. Okay, I'm going to go ahead and save and checkout. And there you go. It actually popped up just now, waiting for 5 minutes. So this patient actually has been waiting for 5 minutes. That's why the alert came up. So now you realize, okay, the patient has been waiting. Now they're ready to come back to the operatory. You can move them in any that you see necessary. Go ahead and do that. One thing to notice as you're going about your day, and you guys can see everything here, something to notice as you scroll towards the bottom, there's the office chat room. You guys can chat with the team members that you may have set up. You can create chat rooms between you or the clinical assistant, between you and the hygienist, or the hygienist and the front desk. You can have as many chat rooms you want and click on the right chat room and click a message, and only that person would get the message. Okay, so this is kind of like chat room. But this helps to see basically all the patients within the practice, where they are, where's the bottleneck, too many patients waiting in the check-in area, or there's a bottleneck at the front and somebody needs help at the front. Okay, so that's why this thing is helpful. I mentioned the timing about patient waiting in the check-in area. You move them into the op. there's timers built into everything you're doing here. You can bring up by going to this little chart icon here over here. Click on that icon and you will see information like this. Okay. Again, this is kind of, I'm looking at, I just put in fake appointments, but you guys will be able to see all the data here. Right now, the data is not going to make sense because I put the appointments in for evening, yet the appointment time was set up for the afternoon. Because right now it's about, almost 11 o'clock at night, but I put the fake appointments in for 1 p.m. today. Okay, that's why those kind of timers are off. But that's where you would see that information. You'd be able to see things like the appointment time, what time the patient arrived, when they were marked ready, and once they were marked ready, when the treatment actually started and when the checkout time was. Okay, so that's why it's kind of important for you guys to have a protocol down in your practice with the right team members that, hey, your job, the front desk job, is going to be marking the patient arrived and ready. Once that's done, moving the patient from the check-in area to the operatory will be the job of whoever brings the patient back, which will usually be the hygienist or the clinical assistant. Okay, and they will basically bring the patient back into the operatory. And whoever clicks on checkout, that depends on how you guys want it done in your practice. There are some extra buttons here at the top. Like this button here, it says click this button to delete everything and start over. Anytime you guys feel like, okay, you messed up big time or you don't know what you did, if you click that, I would strongly recommend you not touch that. If you basically click that, everything gets cleared out from the screen. Nothing gets deleted because technically the only thing getting saved on this is your checkout notes, which go into Open Dental. But it's basically saying, okay, I'm starting over. So now I'm going to look at the next patient and mark them arrived. Okay, and then I'm going to start again and just continue forward. You see, this patient just got arrived. If you mark the wrong patient, sometimes it does happen. You think you click on the right patient, but you may have been active on another patient. If you clicked on the wrong patient arrived and the patient's not here yet, there's an X button at the top. You guys can just click it, okay, and the patient disappears from there. And in order to mark that patient arrived again, this is exactly what you would have done in Open Dental anyways. And now again, you can mark it arrived, and it'll show up again on Practice Pulse again. All right, I think that's it. And hopefully this was helpful. Take care, guys.